Welcome back, everyone. We've got our guest today. He's here to talk about open enrollments with Medicare this morning. Sarah Scary with the Nebraska, I forgot where you're from, the Nebraska-ship program there, the outreach coordinator there. Yeah. Sarah, thank you for joining us today.
Yeah, thank you so much for having me.
So talk about this. What exactly is open enrollment?
Well, open enrollment is a chance for people on Medicare to review their plans and come in and see if they can find something that's more cost effective or which would benefit them better health-wise. So we do it from October 15th through December 7th, and we would love to have people come in and schedule an appointment with us, and we can look at their plans unbiased.
And what kind of people does this affect? Everyone on Medicare, obviously, but...
Anybody who's on Medicare, or maybe people who are going to be new to Medicare, we would welcome them to come in as well.
All right, and what is the difference between Medicare and Medicare Advantage?
Well, original Medicare would be the one maybe people would remember that their grandparents were on, and it's Medicare Part A, your hospital, Part B, your medical, and then you would purchase a supplement and have another plan for your prescription drug coverage. Medicare Advantage is pretty new, and it sort of manages all of your Medicare for you, and they also have some additional things like maybe dental or vision. It's kind of a program maybe similar to health benefits where you kind of pay as you go, where you make a copay when you go to the doctor.
And what do you mean by, making sure a plan meets a person's needs? Because this can be confusing for a lot of people. I know I get confused anytime people talk to me about benefits, and so I need everyone to give me kind of that almost 5-year-old level of explanation.
Absolutely. The plan to meet the needs of the person. So if you're a person who maybe doesn't have a lot of medical needs and you don't foresee yourself having them, then maybe a Medicare Advantage would be best for you. It's a low to zero premium. Like I said, pay as you go. So you'd be making the co-pays when you go see your doctor. Original Medicare, you do pay for your supplement and Medicare Part B each month, and there will be low co-pays, if any co-pay, to go to the doctor. Just kind of similar to what has been always happening, that we've always had in our country.
Yeah, exactly. What are some other resources that you guys have at the Nebraska-ship program? Yeah,
we really can help you find anything that you need with Medicare. We can answer questions. We also help people with fraud. We've been seeing a lot of Medicare fraud, and we would love to help people with that. So if you suspect any kind of Medicare fraud, give us a call and we can look into it for you.
Can you explain that a little bit? Because we get tips all the time about scams, especially taking advantage of elderly people. Can you kind of explain what that situation might look like?
Yeah, well, one thing that we've been seeing a lot of is people will call up and say that they are from Medicare and that they have a new Medicare card for them, and that they need their Medicare information so that they can send them that new Medicare card. They will take the people's Medicare information and actually bill Medicare for a service that they did not receive with that information.
That's obviously not good. So you guys are there to help out there.
No, it's not good.
All right. Again, open enrollment October 5th through
October
December 7th.
October 15th through December 7th. And if you want to give us a call, we're at 1-800-234-7119.
All right, Sarah, thank you so much for talking to us.
Yeah, thank you so much for having me.
All right, we're going to be right back with more news and weather after the break.